Thanks for tuning in again. Excuse me, Joe DiMatteo of the Len and Joe Ask the Pharmacist Broadcast. If you've heard about us through the website or listening to the radio, great. If you've heard about us through a friend or whatever, know that we have a lot of these presentations that we do. Our website is loaded with information, and we're continuing to try to update them and bring you more and more information. I'm going to do a follow-up on the mammography. I won't call it paradox, but some of the mammography conundrums that we're having right now. The mammography conundrums are mammograms everything that they're cracked up to be? And I think there's a big, huge question mark out there. In the previous posting that we did, we talked about mammograms supposedly being done to reduce trauma, improve detection, increase survival, and reduce the amount of radical types of surgeries that are done. The research coming out of Oslo and out of Scandinavian countries show that actually the rates of mastectomies get into probably a 30+% range higher. Very traumatic surgery. Now, they didn't get into whether or not there was an increased survival, etc. I want to deal with that in mammography part 2, which is today, and also going to talk to you a little bit about breast health and what women need to know. I might even kind of spawn that over into a third posting as well. I'm going to give you a couple of quotes. American Cancer Society says that mammography decreases breast cancer risk by 30%. Actually, Journal of the National Cancer Institute did a complete review and shows that there's a net zero effect, not a 30% decrease. And their functional rationale for that is that what you're looking at is clinical trials in a controlled setting, in a hospital setting where the entire environment is controlled, everything from beginning to the end. We follow this versus a typical outpatient setting, community-based screening scenario, which is what 99% of the folks, unless they're enrolled in a clinical trial, are going to be exposed to. So the reality of it is, does it really decrease morbidity and mortality? British Medical Journal 2003 says women need to understand the benefit versus the risk. That's what these teachings are all about. That's what these postings are. Oh, you and Len are anti-mammography. No, we're here, we're pro in favor of you. We're pro teaching you what you need to know about this. What do you mean what I need to know about this? That there's a downside, much of which the traditional scientific community, medical community is not talking to you about. They're just talking to you about all of the benefits. Let's move on to another posting from Cornelia Baines, Dr. Cornelia Baines, University of Toronto. A few years back, 2003, basically said this, that a woman's death rate increases from breast cancer more so than unscreened women ages 40 to 49, which is no doubt contrary to what we would see due to micrometastases. Also, the rates of ductal carcinoma in situ go up by 30% for women that are screened every year, 10 consecutive years, ages 40 to 50. Hence, if you noticed, there seems to have been a lightening in recent months to year or two about this high level of pressure to get women to begin screening earlier and earlier and earlier. I mentioned in the previous posting that women that have BRCA1, A1, BRCA1, and BRCA2, which puts them at a higher risk for developing breast cancer because of genetic mutations. If you go back years, they were encouraged and told the earlier the better. You've got to screen even if it's at 30 years of age because you're at a high risk. You have this genetic mutation. The literature then actually shows that there, on balance, is no net benefit. Actually, there's an increase in breast cancer in these women because of the mutations that are enhanced from the mammography. Also, Dr. Retzky 2001 et al., Breast Cancer Research and Treatment was the name of the article, in essence, said that screening and resection may actually accelerate breast cancer mortality. And the reason why I say screening is because you need to understand that mammography screening evokes rays, X-ray, if you will, to that tissue compressing the breast tissue, enhancing DNA damage. Now, I think that before I go on, the question may be, and if you're a healthcare practitioner listening to this saying this is heretical, you're a heretic. Who are you anyway? Well, I'm a pharmacist, I'm a Board Certified Clinical Nutritionist, and I have a doctoral degree in Naturopathic medicine. And say this is heretical. No, it's not heretical. I think that women are not being told of the risks that are involved. You're going to go forward with it, you're going to do it, that's fine, but you should know the inherent risk. You should understand what the inherent risks are. I believe that in a further posting, I'm going to talk to you about how to enhance women's breast health. We'll try to do it in this sitting. If we can't, there'll be a part 3. Mammography 1, Mammography 2, and breast health, and then breast health, which will be the final part of this, number 3. 3 years post-screening, Dr. Baines points out that starting in a patient 3 years post-beginning screening, the chances of death due to breast cancer almost doubles. That almost doesn't even make sense. You know, everything that we do to attempt to reduce the risks, it's not borne out in all of the literature. And I can give you some other articles from around the world that would actually support this. Cornelia Baines says it's a willful, direct quote, willful silence in the medical community. This was a quote that was in Scientific American. Mammograms seen as risky for some women, Journal of Clinical Oncology. There's a catch-22 for BRCA1 and BRCA2, as I indicated to you, individuals. Mammograms, the benefits are under debate in Britain, March 31st, 2009. The New York Times does a complete expose on it. Another scenario, many research institutes now not recommending routine mammography for women in their 40s. Why? Due to what I commented earlier on the mammogram paradox. Let me explain that to you very quickly. Mammogram paradox actually indicates and shows that women that have mammography screenings every single year from age 40 to 50 have an increased risk of developing ductal carcinoma in situ, a form of cancer in the ductal areas. The paradox. It's termed the paradox in the medical community, and I'm not sure what that's to mean. Obviously, if I do a technique or employ and engage in a technique that's supposed to benefit and supposed to help and improve detection and improve my survival time, what's the word paradox mean? The word paradox means to them in the medical community, they can't explain it. I would say to you, we can't explain it. I would say to you that the issue is that we're driving radiation with compression of breast tissue through those cells, and we are enhancing DNA and genetic mutations because of the compressed and intense X-rays that are going through that breast tissue. That's the truth. And it's appalling, unfortunately, that many healthcare practitioners are not willing to talk about it. I feel our role, what Len and I would like to do, what we attempt to do on the radio broadcast every day, 6 days a week, what we attempt to do in these postings is to educate you, to let you be an educated consumer. Ask questions, read, research for yourself. Right now we have a tremendous amount of research at the fingertips, in essence, from a computer standpoint. Be careful of what you read. Make sure that's documented. Everything that we've talked about here is documented. British Medical Journal, 2009, summaries of Canadian, Australian, Norwegian, Sweden, United Kingdom studies show that 1 in 3 breast cancers detected in organized screening programs are actually overdiagnosis. They're overdiagnosed. Folks, the mammogram debate rages. This is not just a Len and Joe vendetta. It's not. I want to educate our folks and our listeners. We would like for you to be aware of what the downsides are and what the upsides are. And the next posting that I'm going to do, it's just going to be termed breast health. And I'm going to take some simple principles about improving breast health. Thanks for being with us.